हेलो अस्सलाम वालेकुम कैन एनीवन कंफर्म इफ माय ऑडियो इज क्लियर और बैकग्राउंड वॉइस नहीं आ रही।
वालेकुम भाई, आपकी आवाज़ क्लियर है। बस हम ये 5 मिनट तक शेयर करते हैं, स्टार्ट करते हैं।
हेलो अस्सलाम वालेकुम कैन एनीवन कंफर्म इफ माय ऑडियो इज क्लियर और बैकग्राउंड वॉइस नहीं आ रही। हाँ सही है, ठीक है। मैं यहीं पे हूँ, वेट कर रहा हूँ।
Assalamu alaikum. Am I audible?
यस यस, ऑडिबल हो यार।
Assalamu alaikum. My name is Hamad Afzal, Sub Finance Section in charge MAS. I invite
Assalamu
you
alaikum.
all.
Am I audible?
Yes, you are audible. May I continue?
जी हमारा, आप कंटिन्यू करें।
Thank you. My name is Hamad Afzal, Sub Finance Section in charge. I welcome you all to the first ever Meditech Renaissance conference on the theme Healthcare with Medicine, Public Health, and AI. Today, we are gathered here for the first pre-conference workshop on the topic Art of Research Presentation with Dr. Faizan Shehzad. Dr. Faizan Shehzad is a final year medical student at Rawalpindi Medical University. He has more than 10 publications across national and international journals. Moreover, he has also been invited as a speaker at different undergraduate workshops, both on campus and online. He has presented researches across national and international platforms and has won many rewards. Today, he has been invited to this workshop to enlighten us regarding the art of research presentation. Dr. Fizan Shehzad, you may continue with the presentation. Thank you.
Thank you so much for the kind introduction. And first of all, let me share the screen with you all. Okay, so I hope my screen is visible. Can anyone tell me?
Yes, sir.
Okay, so as you know, the research presentations are basically divided into three main parts. The first part is the synopsis presentation, which is actually the summary of the research, or it is a thing that you need for the approval. After the synopsis, then we have two types of the research presentations after it has been completed. The first one is the oral presentation, and the second one is the poster presentation. Let me first of all show you guys a template for all of these three presentations. And as you can see, this is the synopsis. The synopsis is basically an outline of your research, right? It has the methodology, introduction, and ethical consideration, references, etc. But it does not have the results and the discussion because the research has not been conducted yet. It is about to start, right? So this is the main synopsis. I will one by one tell you guys how to present each and every one of these things. The second one is the oral presentation. Now, this is a detailed presentation. This is a detailed PowerPoint slides of your whole presentation, of your whole webinar, or of your whole research that you have conducted. So, all of these, as you can see, it has the results, and then it will also have the discussion. So, this is a detailed, um, you can say, presentation or detailed slides of the whole research. And this obviously has more questions regarding this. This already, like as you can see, this needs more expertise in this matter. And lastly, the easiest one, in my opinion, is the poster presentation. As you can see, it is just a single slide with everything written on it, and it's just a 3 to 4 minutes presentation that you have to give. It's not that much detailed, and it has a few questions as compared to all of the other two types as well. I will one by one, once again, I'm telling you one by one, tell you how to present each and every one along with an example, and then we'll also have a question answer session. So don't worry, like everything will be explained to you in a manner. Um, what I would like to start with is the general tips. Now, these tips are not specific to any presentation. These tips are basically in everyday life. These are responsible for hosting a webinar like he did right now, or for presenting a webinar or being a speaker in webinar like I did. Unfortunately, my camera is not working right now of the laptop, so I'm not able to maintain an eye contact or tell you guys of the whole body language. But the thing that you need the most is confidence. As you can see that right now, I'm not stuttering much. I do stutter a bit. Everyone stutters, but not that much. Moreover, I'm not having anxiety or I'm not shaking. I'm not having tremors, etc. And this all comes with having a practice with all of these things. So you need to have a focus on confidence. You need to be confident. You need to know that what you are saying is correct and that people will listen to you, even if they don't. That's the main thing. You should be confident in yourself. And if you are not confident, I think there's a very low chance that you can actually win something. If whereas if you are confident and if you already do make mistakes, I do as well. But then again, they will get overshadowed by your confidence, and you will, inshallah ta'ala, win these prizes. Anyways, the thing about eye contact is you have to maintain the eye contact with the judge. You have to maintain the eye contact with the main person or the focal person of uh, the synopsis approval committee, right? Your body language should scream, or your body language should be professional. It should always say that this guy knows what he is doing. It should not be shaky. You must not be anxious. You must not be nail biting and all of that. Then the fourth point is the fluent language. You should not be, um, you know, like waiting 5 to 10 seconds after each sentence to make it up in your mind. You should always be on the go. You should always have things to say, and you should always be fluently making sentences one after the another. No one likes a person who is gonna stop it. Like, would you even listen to me if I said, confidence is a key factor? And then I pause for 5 to 6 seconds, and then I say the second key factor is eye contact. No, you wouldn't. The main thing is you need to be fluently bringing in new ideas. You need to be fluently bringing in new sentences. Timing is something that's especially important during the poster presentation because you have a very limited time. Whereas in synopsis, you have a lot of time, so it's okay. But you should always practice beforehand in your home, in the front of mirror. And like for me, practicing in the front of mirror and then practicing it in front of my friends was the most important and was the best technique that I have used. If you present a research 3 to 4 times to yourself and to your friends, I don't think you're gonna stutter. I don't think you're gonna lose confidence, and I don't think you're gonna basically take pauses in front of the judge. So, which is why I've also written it 3 times actually. Practice, practice, and practice is the most important thing. And lastly, content. Of course, if you're gonna present something, you're gonna need good content. You cannot have a cross-sectional study win against a meta-analysis, no matter how good your presentation is, because obviously a meta-analysis is a far better research than a cross-sectional study. So you need to make sure that content is also good. Moreover, the general tips which are now specific to the presentation include starting with the name of Allah Almighty. You need to make sure that whenever you are presenting to a Muslim or a Pakistani committee, you need to start with the name of Allah. Like there are people, especially the old people, they cut marks if you do not present with the name of Allah. Like I have literally seen it with my own eyes. They read my -1 or -2 along with your name. So you need to like be sure of this. Similarly, same is the case with saying salam. Starting with Bismillah and saying salam are the two prerequisites to presenting only in the Muslim presentations. If you have non-Muslims or if you are just presenting to a European or a United States, it's okay then, no problem. But here in Pakistan and Muslims, you need to do this. Moreover, if you have time, you can also ask the person that may I start with my presentation? May I start my oral presentation? Or sir, may I start speaking? It's just a polite gesture that's appreciated. It's not necessary, but it's appreciated. But the thing is, in poster presentation, you will already have a hardly 3 to 4 minutes. So instead, I recommend that do not do this in posters because you need the flow. You need the increased flow in the poster presentations. Then the introduction. The introduction is probably one of the most important things that you will ever do. You need to be sure that what you're saying is fluent. You need to grasp them with the introduction. You need to show them that your name, your year of study, and your institution. You need to say all of these in a single sentence, and then you're gonna tell your role. Let me give you an example. For example, if I'm presenting this poster right here, I will say, Assalamu alaikum. I'll first of all say, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum, sir. My name is Fizan Shahzad. I'm a final year medical student from Rawalpindi Medical University, and I am the primary author of this research. The title of my research is Identification of Risk Factors for Late Onset Sepsis in Post-Op Neonates. This took, I think, 25 seconds, but the judge in front of me knows who I am. He knows my year of study. He knows I'm a medical student. He knows my institution. He knows the title of my research. And he has also, I have also said salam to him. And I have also started with the name of Allah Almighty. So this is probably one of the best ways to introduce yourself and to start any presentation, not just a poster, like any presentation. And I have seen these in professional people all across the conferences in Pakistan, in online, in international, everywhere. This is how people present it. So after the introduction, the whole presentation, you're gonna present your research or you're gonna present your synopsis. Towards the end, you're gonna always say thank you for listening, and then you're gonna say, uh, I will be open to questions, or you can now start asking questions. The invitation to ask questions is probably one of the most important things, because by inviting the other person to ask questions, you're not only being polite, you're also telling him you have the confidence to tackle their questions. You are actively inviting them that come and ask questions from this research because I have prepared it. There's nothing that you can find in this research that's going to make me anxious. So which is why I'm confident in my ability to answer your questions. And this actually presents a very powerful psychological impact on the judge. So after they ask the questions, once again you have to be polite and say thank you for questions. Now I will answer them, and then you're gonna answer the questions. Now it doesn't matter if you don't know the question, or if you don't know the answer. Uh, Answer whatever you can to the best of your ability. And if the judge said that is not what I asked, then you have to say, I'm sorry, sir, I do not know the answer. Never ever say, do not, I'm sorry, I do not know the answer at first. Always try to come up with something. Always try to answer the question, because the person will see that even if he does not have the question, or if he does not have the specific answer of that question, he still tried. He still tried to the best of his ability, and that is what matters. Okay? And once again, be polite. Now we're gonna go towards the synopsis. The synopsis is the most important thing before conducting a research. The whole approval of your research is based on the synopsis. Now I'm gonna first of all tell you the important things that you have to keep in mind. The first one being your title should be self-explanatory. As you can see in this title, it is Association of Inflammatory Markers with Stroke Severity and Functional Outcome Following Stroke. So this shows that what I'm doing is I'm gonna associate inflammatory markers, which basically means WBC count, neutrophil count, lymphocyte count, with the severity of stroke and its functional outcome. Okay, this your title should have around 2 to 3 main things. The first one should be your disease, stroke right here. The second one would be your exposure or risk factor, which is the inflammatory markers. And the third one would be how you're going to measure it. We're going to measure it using stroke severity and the functional outcome. If you have these three things in the title, I think it's enough. Some people would always enter a study design, such as for this one, it was a prospective cohort, but it's not required. In meta-analysis, I usually add it because if they see that it's a meta-analysis, they're gonna be, sort of impressed that this person chose to do the highest level of study. But in cohorts, I do not add it, obviously. Now, the second thing that you're gonna do in synopsis is you do not need to focus on introduction like at all. What you need to focus on is methodology. You need to focus on the objectives. The introduction for the synopsis, when you're presenting a synopsis, you're not gonna present it in a Word document. You're gonna present it in slides, in PowerPoint. And so the introduction, you're just gonna add the definition of your disease. You're gonna tell how many people die by it just to show to them how important the disease is. Then you're gonna tell all of the inflammatory markers, the name of the inflammatory markers, and then you're just gonna say that the inflammatory marker has been linked in different researches, but they were not linked with stroke severity or stroke outcome, which we will also focus on the rationale. As you can see that these are low cost and easily accessible markers, which can be potentially valuable biomarkers for risk stratification and prediction of prognosis. You're just gonna tell the importance of your research in rationally, and in the objectives, you're just gonna tell what are you going to do in the research. Like in this research, I'm going to determine the association of these three markers with stroke severity and functional outcome. So the objective is just going to be me saying what I'm going to do in the research. Rationally is going to me telling why my research is important, and then I'm just going to focus on the methodology. The methodology includes hypothesis, operational definition, and then all of the study setting, population, etc. I'm not going to go into the detail of all of these headings because, as you can see, this is just about the presentation part, right? So if I'm presenting this one, I will may or may not totally skip the hypothesis, right? But in this cohort, it's an important hypothesis. So I would say that NLR, PLR, and SII are significantly associated with both stroke severity and functional outcome, which is our hypothesis that we will have a significant relation between both of these variables. Now, one thing that you're going to be absolutely sure is that you will first have to say everything in its full form. For example, NLR is known as neutrophil to lymphocyte ratio, PLR is platelet to lymphocyte ratio, and SII is systemic immune inflammatory index. So I'm going to first of all say all of these in their full form, and then I can use abbreviations. You cannot use abbreviation before saying the full form. There are people who actually would mind and cut marks if you do this. Then I'm gonna go towards the operational definition. This is all basic synopsis stuff. The important thing that you're gonna focus in the research methodology is not the settings, neither the population nor the duration. What you're gonna focus on is the design. You're gonna focus on the sample size. You're gonna explain how you calculated the sample size. You're gonna explain the type 1 error. You're gonna explain the type 2 error, and then you're also going to explain the whole value of the sample size, and then you're going to of course explain the null hypothesis value. Then the second most important thing would be the inclusion exclusion criteria. Most of the questions in synopsis that they ask include questions from inclusion criteria. Why did you include only these people, or why did you include, like for this example, why did you exclude people with hematological disorders? And the reason for this one would be that we excluded these people because hematological disorders would have a different value of neutrophil and lymphocytes. Thus, they would disturb our study. Similarly, why did we exclude people with steroid or immunosuppressive? Because they are immunosuppressive, or steroids are immunosuppressive medications. They would decrease the level of neutrophil, they will decrease the level of lymphocyte, especially the immunosuppressive medications would decrease the neutrophils, whereas steroids would increase the neutrophil. So it will basically alter our study results. And so this is the main thing that you need to focus on. You need to be absolutely robust in your inclusion exclusion criteria and in your sample size. So after having this, the second thing that you're going to focus on is the data collection technique. For example, in this study, the main thing that you're going to ask us is how are you going to go and take the data from the hospitals? So what we basically answered, and this is actually a question that they asked me. So what I said was, me and my colleague, we basically answered them that we have different rotations in different hospitals. And so we're each going to go to the medicine department of respective hospital, see people of stroke, then assess if they come into the inclusion criteria, ask a postgraduate trainee there to calculate these score, these stroke severity for us, and then we're gonna collect data. because they want to see that if you're studying a research, would you be able to complete it or not? And the main thing that they're going to see is how you're going to collect the data. So let's say you have a defined inclusion exclusion criteria, you have a defined sample size, but if you cannot collect the data, what good would be the research? See? So all of these points I have also mentioned here, that you need to focus on methodology, then you need to focus on these 4 points. After you have done this, these are all the things that you're not going to focus on. The time period, the funding, the work plan, these are always the same for each and every study. Then ethical considerations is most important these days. It doesn't used to be important in the early 2000s, but now it is actually very important, and you would have to focus on it a lot more. You will have to show that you won't disturb the data of the patients. You would not do anything unethical. And for that, we have also informed consent, as you can see. The informed consent is a very important thing, and it was introduced in RSRS last year as well, that you need to have a whole form that you will sign by each patient before taking their data, because obviously ethics are now the main thing for the research. Lastly, after you have done the whole presentation, you're gonna always invite for questions. You're gonna say, "Thank you. I have now completed my synopsis presentations. I am now gonna invite you all for questions." So you're gonna invite for questions. They're gonna ask the questions. You're gonna answer the question, and then you're going to say that is actually a very good point, or thank you for asking these questions. You're going to be polite, and then you're going to answer the question. After the question is answered, you're going to say these words: "I hope your query has been settled, and if it has not, I will be happy to repeat my answer." You need to show them that you are here for this facilitation. You're going to answer their questions, and you're going to uh, do each and everything to show to them that you yourself have the whole preparation. You yourself have come with the whole preparation. You yourself have nothing to be scared of. You yourself have no mistake that you did, and you yourself are ready to quench each and every doubt that they may have. This level of confidence will be sure shot to basically win you everything, or get your research approved or published, etc., etc. So after the whole presentation of the synopsis, we're not gonna now gonna move on to the oral presentations. If there are any questions regarding synopsis presentation, kindly let me know. You can also mention the questions in the chats if there are any questions there.
Thank you so much, Fazan bhai. The questions will be asked at the very end as they are being noted on the YouTube chat by our attendees. You may continue with the presentation for the time being. Thank you so much.
Okay, sure. I will continue a whole presentation, and then we will ask the questions at the end. It's okay, whatever works. Anyways, so now we're gonna go to the oral presentation. The thing about oral presentation is that it's a detailed presentation regarding your whole research. So you need to be able to answer each and everything about the research. That's the main caveat with oral presentations. The thing that people are actually scared of oral presentation is the same thing that I've told you right now. Now, personally, for me, I always prefer oral presentation, because in oral presentations you can tell the judge this, this, and this, or you can explain the judge in more detail. Personally, for me, I have the main thing in my researches is the methodology and the results. So the judge, I make sure that the judge cannot find a single mistake with the methodology or research or the um, results of the research. So for me, oral presentation is good. If your research is a cross-sectional study, I would say always go for a poster. If your research is a case report, always go for a poster. If your research is a cohort study, a clinical trial, or a meta-analysis, always try to go for an oral presentation. But if it does not get into oral, then a poster is fine. But I think that especially for meta-analysis, and oral presentation is very important because you need to add each and every forest plot and you need to explain each and every outcome. But the oral presentation that I have right now with me includes a prospective cohort and a cross-section study. The reason I chose cross-section study as an oral presentation as well is because I need to show you guys for each and every scenario. So I need to basically tell you guys how you're gonna handle each and everything. And mind you, all of these presentations that I'm showing you are the ones that I have won something on. So it's not gonna be me telling you guys things that are not tried and tested. All of these research have been won in a competition at a national or a multinational level. So first of all, starting the oral presentation with a prospective cohort, me and my co-host Zara basically presented this in the Recon 2023. As you can see by the title, this won the runner-up for oral clinical presentations. The first position went to a meta-analysis because obviously a meta-analysis is better than a simple cohort study. Now, the thing in oral presentation is that you're gonna have 8 minutes, and 8 minutes are a lot of time. So you're gonna focus on each and every aspect of your presentation. You're gonna tell the title. What you're gonna say is, for example, in this, we basically said, Assalamu alaikum, Bismillahirrahmanirrahim, Assalamu alaikum. My name is Fidan Shahzad, and I'm the co-primary author because we now have two authors. I'm the co-primary author of this study with the co-host or co-author of Zara Hassan. I am a final year student from Medical University, Rawalpindi Medical University, and my co-host is a fourth year medical student from Rawalpindi Medical University. The topic of our presentation or the topic of our research is the evaluation of early prognostic factors of mortality in patients with acute pancreatitis. This topic has once again the disease, the risk factor, early prognostic factors, and the thing of that we are assessing is the how we are measuring the severity is the mortality, or how we are, the thing that we are measuring is the mortality. So it once again has the three main parts. Then we're gonna go to the introduction. Now, what's the first thing that you notice right here? The first thing that you notice is that the heading is clear, the text is clear, the text has the important things highlighted. There is a small image or a smart art here to make the presentation visually appealing, and there are logos right here. These 4 to 5 things are a must in oral presentation in each and every slide. What this does is the logos make it professional. The heading makes the judge see or the judge assess that what is happening right now. The text fills the area. The bold text shows the thing that is important or the thing that I'm gonna say. If I'm presenting the study and I forget something, I'm quickly gonna glance back at this bolded text and just gonna jump right back in the presentation. The thing that I have done right now is that by bolding each and every stuff, I'm not gonna forget what I'm gonna say next. For example, if I forget what I'm gonna say after this whole mortality point, I'm just gonna look at a presentation. I'm gonna see that the mortality is 2 to 5%. I'm just gonna jump right back in. I'm gonna say that a mortality was 2 to 5%, whereas in severe cases it can even be 30%. And so I'm not gonna fumble. I'm not gonna stumble in the presentation. And lastly, the image makes it visually appealing. Once again, the second slide of introduction, the thing that you're gonna do is you're gonna first of all define your disease, then you're gonna define its epidemiology, then you're gonna define its severity, which basically tells why it's important. Then you're gonna tell something about the disease, such as how it's measured, what are its types, how do we classify it, how do we diagnose it, etc. And then you're gonna see, then you're gonna link the exposure factor or the risk factor, in our case, the early prognostic factors, with the disease, which we basically did with the scores, right? And then we're just gonna tell that there are two phases, there is severity, and then there are two types, etc., etc. The rationale and the objectives are a very important part of your research. This smart art right here, why not, includes the rationale because it shows the importance of your research. And this right here, the target sign shows the objective. Once again, smart art, text, bold, heading, and logos. You need to follow this formula. It's not a necessity. There are people who have just bilkul bland slides. But then again, you're not here just to present. You're here to win the competition. You're here to grab a prize. You're here to fill your drawer with shields, right? So for that, you're gonna do this extra hard work. You're gonna do this extra work. I know it takes a time. The first time I did this, it took me a whole day to make a presentation. And right now it takes me 2 hours. And I'm sure during my residency or after I become a consultant, it's gonna be even less. So with time, you're gonna get more and more better at it. The rationale would always tell the importance, the objectives will tell what you're gonna do in this research. And now we're gonna go to the methodology. Now, what's the first thing that you see at this by watching at this slide? The first thing that you see is the hospitals. If you're presenting at an undergraduate level, if you're presenting at a medical college level, be sure to make it visually appealing, be sure to add pictures in it. But if you're presenting it at a postgraduate level, if you're presenting it at a multinational conference and you're presenting an oral presentation, try to keep these pictures at a minimal level. Now, all of these presentations that I'm showing right now are presented at an undergraduate level. As you know, I'm still a student, so all of these are undergraduate. But what personally I would recommend is that you add pictures to the minimal, and instead you add important things which are like this, these logos, as you can see, or these graphs. These are more important. Now, if you compare this presentation with this one, I'm pretty sure you're gonna say that the acute pancreatitis one is better. Why? Because this both of these has the same background. But the thing is expertise. The thing is practice. The thing is I now know how to make a presentation better. And so I've made this one a bit better. If I presented this at the recon, I'm pretty sure you're gonna say that this thing at the psychon, at the annual psychiatric conference, whereas this one was won at recon. Recon basically entails all of the sports specialties. And so winning at recon is a better thing than winning at a psychon or the niche specific presentation. After this, we're gonna add the methodology. You're gonna add each and every heading. What I usually do is this is for the prospective cohort, and these both are the sample sites, which include the hospitals of our medical college. The inclusion exclusion criteria is very important. You're gonna have to add it as a single slide, and you're gonna explain it. You're gonna even if you spend 20 to 30 seconds at inclusion exclusion criteria, it's okay, because this the main questions that you're gonna ask you are the ones there from inclusion exclusion criteria, data collection, or sample size, like I said in the synopsis. Then once again, sample size calculation, a whole slide is dedicated to it. Once again, you can see these images which are presented here to make it visually appealing. Then you can see that I've added an image of ROC curve because this study used ROC curve and it used ROC curve analysis. So I've added it. In this study, uh, in this cross-section study, you can see that I have used a parental stress scale. Data collections tool is the parental stress scale. So I've added its logo. I've also added the logo of ANOVA because ANOVA is a statistical test that I'm applying. More other options that you can do is add the SPSS logo. You can also add the chi-square logo or things like that. Try to keep pictures at a minimal and logos at a maximal. As you can see, I've added here the ROC curve analysis. Now, data collection tool is also important. If you're using a data collection tool which is already pre-validated, such as the parental stress scale, you just need to mention it. But if you're using a data tool that you made yourself, you're gonna explain the whole data tool. You're gonna add it here. You're gonna say that these are the demographics, these are the pancreatic severity survey, this is the mortality question, these are the lab reports, etc., etc. You're gonna have to explain it. And it's okay if you explain it in a 30 to 40 seconds, it's up to you. But you should explain it because otherwise they're gonna deduce marks. Now the results, the first thing that you're going to do with results is that you're going to explain the demographic. As you can see, the total number of patients, the age, the gender, the etiology, etc., etc. Then you're gonna come towards the disease severity or the disease mortality, which in this case we presented both of these. In the terms of a cross-sectional study, these are the demographics, and then this is the, you can see these are all the different diseases that we included in this questionnaire. After the cohort study, you have explained all of these severity. You're now gonna come to the prognostic factors. You're not going to come to the main crux of your research. And then you're going to explain all of these. I will always recommend you make as many tables as you can. Tables are visually appealing. Tables are summarized the data. Tables are easy to understand. Add a minimal text. Just add a table, add a heading on the table, and explain the table. That's enough. As you can see in this, I have also added table per table. Like you can see, all of these results include table, table, and table. The one thing that I would say is add different colors. In this study, I have added only blue color, and this is from 2022. But the more recent one, you can see I've added blue, green, yellow. The wide variety of colors would actually make it visually appealing because you cannot add any figure, just add color in the table. And now the ROC curves. Obviously, it's important that you add figures, as many figures as you can, as many charts as you can, because the results are actually easy to understand with these figures. Instead, if you add text, they're just gonna be reading the text and not listening to you, and it's gonna reduce number. Now towards the discussion, the discussion has text in it, and so you're gonna fill it with text, but you're gonna also add these things which are important. For in our study, the RDW greater than 13 was important, so we bolded it. Then once again, you're gonna add the images to make it visually appealing. You can also add the p-values in the discussion to give it a sort of authentic look, and then obviously you're gonna add these all of these, charts and figures with the text. One more thing that you're going to focus is that I have added numbers here: 11, 4, 1, 12, 13. These numbers are the references. In an oral presentation, references are of the utmost importance. And the reason is because the oral presentations, people are actually listening to you, they are actually focusing on your research, they are actually reading up the discussion. And so you should also have the literature, the literature proof that you're going to give. If they ask, why did we consider a creatinine value of greater than 1.8, or why did we consider creatinine to be a prognostic factor, we will say that additional studies which were published before us considered this prognostic factor. They consider creatinine to be an important prognostic factor, and hence we included creatinine in our study as well, which in our study also proved to be important. As you can see, I have cited a study from Modana, and I have also cited a study from Lipsinki. One of the things that you can do is that you can bold these names so that they know that these studies are actually authentic. You're not just gonna, making studies out of thin air. So this is what you're gonna add in the discussion with some images. As if you can see, I've also done this here, but I did not add any image. Now that's my mistake. I should have added image, but then again, I was naive back then. I was just in third year, at the start of third year, and this was actually my first oral presentation, which I'm showing you right now. And Alhamdulillah, I did win it as well. Now, the discussion also includes limitations. Limitations are very important. You have to add limitations. You have to mention limitations in your oral presentation. These are not that much important in the poster presentation because you won't have time. But then again, you need to focus on these. Conclusions, the thing about oral presentation is it's detailed. So you're going to add conclusion and recommendations either separately or within a single slide. It's up to you. But conclusion and recommendations both are actually needed in the oral presentations. But then again, if you're in a poster, you're just going to include a conclusion, which I may show right here. As you can see, it's only a conclusion. There is no recommendation. Why? Because we won't have time for this and we won't have the need for it. Then after you have done this, you're going to add the references. And after references, actually, this is an initial draft. You should always answer add a thank you note like this. you should always add a thank you note, and you should always invite for question answer, which I have said for probably the third time. And this is how you're gonna present an oral question presentation. After the presentation is done in 8 minutes, you're just gonna answer the questions. Now, what some people do is they ask Fizan by how am I gonna manage a presentation in 8 minutes? And for that, I have a uh, you can say distribution of minutes or distribution of seconds for an oral presentation, right? I'm just gonna tell you the distribution that I have done for 7 minutes because you're just gonna keep a minute extra at the final presentation. The reason I say this is because at the final presentation, you don't know if any judge would stop you midway, if the mic won't be working, if you would stutter in between, or if your co-presenter would stutter. So you need to keep extra time for this. And I keep at least 1 minute extra for this thing. The thing is, you're just gonna take 30 seconds for introduction, 30 seconds for your introduction and title, 45 seconds for the introduction of the study, 1 minute or 1 minute and 30 seconds for the methodology, right? So right now we are just around two at the 2 minutes mark, and I think you should be done with this within 2.5 minutes. Okay. Now the results, you're gonna focus on results a lot, and you're gonna spend at least a minute, if not 1.5 minutes, at the results section. After this, we are now at 3.5 minute mark, and we are now halfway across our presentation. Now, of course, you're gonna be a bit slow, so I'm gonna consider that it took you 4 minutes to turn on the mic, look at the judges, etc., etc. So we're not now at the 4 minute mark. Now the discussion, you're gonna spend 2 minutes at the discussion, and the reason you're gonna spend 2 minutes is you're gonna detail, you're gonna explain your results, and then you're gonna compare them in detail with the studies published online, and then you're gonna tell what's the difference. And if there is a difference between your study and the study published online, you're going to explain why it occurred. The main thing is the explanation of why it occurred, because the judge would be seeing if you have done your research, if you have done your literature review, and if you know about the study results, and if you know about the pathophysiology of the results, of the difference in results, right? Then after spending 2 minutes here, we're at the 5 minute mark, at the 6 minute mark, we're gonna spend 20, 30 seconds on limitations, 20, 30 seconds at the conclusions, and 20, 30 seconds at the recommendations. And after all of this, I think you must be past the 7 minute mark, and you're gonna say these are the references. You're not gonna tell any reference, you're not gonna focus on every reference, you're just gonna say these are the references, and then you're gonna say thank you very much. I will now be taking question and answers. And that's it. That's how you do a oral presentation in 7 or 8 minutes. If you have less minutes, you're just gonna cut down 20, say you're just gonna cut down 10 seconds, 5 seconds from each of these parts. Maybe if you have 5 minutes, like we did in this acute pancreatitis presentation, we divided it as 20 seconds in the introduction, in the start, 20 seconds, 30 seconds, 10 seconds, 30 seconds, 40 seconds for the results, then 40 seconds for the discussion, um, 20 seconds for limitations, 20 for conclusion and recommendation, and then 10 seconds for references, 10 seconds for thank you. So that's how you're gonna, distribute the whole time. Anyways, we're now done with the oral presentation. Let me have a quick sip of water, and then we're just gonna move towards the poster presentation. Okay, so I am back. We're now gonna start with the poster presentations. Actually, the poster presentation, the main thing that people feel about the poster presentation is it's easy or that it's a bit different than the oral presentation, but the main crux is the same. And the main thing that you're gonna focus on the poster presentation is the time limit. You need to complete it within the time limit. Also, can anyone confirm if I'm audible? I don't know if the mic is working or not.
Yes, you are quite audible and very clear.
That's good. Okay, so the main thing that people struggle with poster presentation, especially at my level, is by completing it within the time limit. Because when you're a bit senior or when after you have some experience with presentations, you just wanna explain everything. You just wanna tell everything, and that's what you cannot do. So in poster, you have to summarize it. You have to minimize stuff. The thing that you're gonna focus on in the posters is the visual appeal, is the physical appeal of the poster. You need to use good colors. The one thing that I use is I use a combination of dark and the light color. Take things in contrast. If you can see this poster, this is brown. The brown or maroonish color with the light brown color. So that's the thing that you're gonna focus on. And if you see the whole color scheme of the poster is on a dark brown slash light brown contrast. As you can see right here, 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 everywhere. It's a combination of dark brown and light brown. And if you see on this poster, actually this poster that I presented, I won a runner up for poster presentation at the annual surgical conference. And at this poster, I recently won this, I think last week. Yeah, just 2 days before the sports week on the annual Pakistan Neurologist Conference. Now, this poster was presented at an international conference and it won. So I actually adored this poster a lot. And the main thing that they said was at a postgraduate conference, try not to include these images, the ones that I'm highlighting right now. They absolutely appreciated these images. They absolutely appreciated the tables. They appreciated the um, charts that I have made. But they said that you do not have to add these images, the types of stroke image or this Holy Family or PVH image. So I was like, okay, I want, and that's the thing that I want to share with you. Now, once again, if you focus on this poster, what you will see is that there's a color scheme of purple and light purple. Dark purple right here, dark purple right here, light purple right here. So you're just gonna always go back and forth between dark and light colors, right? The poster presentation is less detailed, so you do not need to know all the nitty-gritty details. The main thing that you need to do is you need to complete within the time frame. Once again, there are fewer questions in posters, obviously, because there is not much time, but then again, each question holds more value. For example, in oral presentation, you're gonna get asked 6 or 7 questions, and even if you drop a question, it's okay. Like 5 out of 6 or 6 out of 7, it's okay. Okay. But if in posters, you're gonna get asked around 3 questions and you drop a one question, that's like a 66% success rate. That's not good as compared to the 80 or 85% of the oral presentations. The poster presentation have a few questions, but higher importance, which is allotted to each individual questions. Once again, must be visually appealing. You need to make it colorful, but you do not need to make it fancy. There's a difference between colorful and fancy. If I open up Google poster, now look, each and every poster that you're seeing is having images, it's having diagrams, it's having all of these. These are not a medical research post. So these are for social media. These are for social sciences. These are not for medicine. These are for ecology. These are for physics, etc. For medical, if you search a medical research poster, you will already see a notable difference, right? Now look, do you see any image, do you see any cartoon? Nothing. All you see is text, headings, and graphs. Pie chart, text, headings, paragraph, title, logos, title, logo, paragraph, circle. This is known as a specific type of pie chart. This is a line graph. These are the I think X-ray images, or these are actually the CT scan images. This is the PET scan, etc. These are also the CT scan. So you see, that's the difference between a medical and a poster of social sciences. I used to make poster like these, colorful, pictorial posters, but now I'm slowly and gradually shifting towards posters that does not have these. I'm just going to remove these, this, etc. So, and I will also ask you guys to do this as well. Now, one more thing that you're going to focus is the methodology and results. If you can see on this poster, there's a whole two columns for only methodology and results. Like these are a 1, 2, 3, 4, 5 headings in two columns, and these are two heading in two columns. Moreover, if you see this poster, 1.5 rows, columns, a half of the poster is only the methodology and results. And that's the main crux. When I was presenting this posters, I started with introduction, and the judge actually jumped towards the sample size, and he asked about a question about the sample size. And then instead of going back to the introduction, etc., I just mentioned the aim, and I started at the methodology. And then he stopped me during the methodology at, I think, 1 minute mark, and he said, just explain the results beta. We don't have enough time to go through the methodology. And so I explained the results in 1.5 minutes. And he said, then he asked some questions, and my presentation was over within 2 minutes. So that's the main thing. In the poster, the time is of the essence. So focus on methodology and results, which are the main crux of your poster. Introduction is just once again 3 to 4 lines. If you can see, 1, 2, 3 lines here, and 1, 2, 3, 4, 5 lines here. Moreover, the discussion is not mentioned. There is no discussion of anything in poster. There's only explaining the methodology and then the results. Moreover, references have less importance, and then you can just add 2 or 3 references. Two I have added right here, and I think I added just 4 right here. So that's okay. Now, how you're gonna present a poster? So I'm just gonna give you an example of this neuro one. I'll first of all say, Auzubillahi minash shaitanir rajim. Bismillahir Rahmanir Rahim. Assalamu alaikum everyone. My name is Fizan Shahzad, and I am the primary author of this research. I'm a final year medical student from Rawalpindi Medical University, and the title of my research is Association of Inflammatory Markers with Early Mortality Following Stroke. Now, after shown the whole title, I'm not gonna say now comes the introduction. I'm not gonna say the heading of introduction. I'm just gonna say cerebrovascular accident are the leading cause of death. They can kill up to 119 cases per 100,000 in worldwide. There are two types of stroke: ischemic and hemorrhagic. Neutrophil to lymphocyte ratio (NLR), systemic inflammatory index (SII), and SCRP and PLR, platelet to lymphocyte ratio, have been implicated in having as a potential biomarkers for functional stroke outcome or for the stroke severity, but they have not been assessed much for the stroke mortality. Now, the objective of our study was the association between inflammatory markers and these early stroke mortality. This was, now I'm not gonna once again mention the headings of materials, or just gonna say this is the study design, etc. No, I'm gonna say this was a prospective cohort conducted at the medical units of Holy Family and BBH with a duration of 1 year from March 2023 to March 2024. You're gonna, once again, like I said in the start, you're gonna say everything fluently. You're gonna not stop between sentences. You're gonna flow between the sentences. You're gonna write the sentences. It had a sample size of 421 with the inclusion criteria of people of hemorrhagic and ischemic stroke which had age more than 18. The reason I chose age more than 18 was because they were able to give consent. Now, the external criteria included people with infection, people on hematological disorders or steroids, and data analysis was done using SPSS. In the results, once again, I'm just gonna go over the result section in a flow and a fluent manner. And I'm not gonna explain the results right now because it's gonna be a waste of time. But the method is the same. In conclusion, I'm not gonna say in conclusion or etc. I'm just gonna say my study will conclude, or I would conclude, or I would like to conclude that NLR, CRP, SII, and PLR are independent risk factors or independent markers for early stroke mortality. And these are the references mentioned below. Thank you so much. Now I would like to invite for question answer session. Once again, thank you. You have to say it. You have to answer for the questions. And one thing that you're gonna do in posters is you're gonna add your email at the bottom. The main thing of adding this email at the bottom is that you can, if anyone wants to collaborate, they can text you on this emails, and after texting you on this emails, they can collaborate with you on research projects. Conferences are the best area for research networking. They are the best areas for people if you want to collaborate with them. And so if you wanna find new people for research, you can always go to conferences, and I would highly appreciate if you uh, attend them and if you win it. Like, it would be an honor for me to have taught someone who won at a conference, especially at an international level. With that, I would like to conclude my presentation. I would like to first of all thank all of the organizers. I would like to thank each and everyone from the society for inviting me as a speaker. It was an honor for us. It was an honor for me personally. I would hope that you understood what I said. I will also take the question right now. And moreover, you can connect with me on Instagram or on LinkedIn. And I have shown all of both right here. You can screenshot them, or Harris would share the link with you as well. And now, question answers.
Assalamu alaikum. Am I audible?
Yes, you are.
Okay. I'm Aisha Hanif, co-publication section in charge at MES. Thank you all for joining us in this pre-conference webinar. Now we are starting with the question answers. You can drop your questions in our chat. Okay. We are waiting for your questions. Okay, we have our first question, that how we will make sure our presentation is not overcrowded.
Okay, so the main thing about making a presentation not overcrowded is your judgment. I'm just going to give you an example of an overcrowded presentation. This right here is overcrowded. If I were a judge, I would have deducted marks on overcrowding on this slide and on the discussion slides. The one thing that you can do is, if you select this text, you can go right here. You can do this as 1.5, do the line spacing of 1.5, and then you just wanna adjust the text according to this. This will actually make the slide way more clean. Like, you can see the difference for yourself right here. That's the thing that you're gonna do. Or what you can do is you can make the slide end the text on halfway, and then after halfway you can add the image. So that's another example way to make the text less crowded. And the thing about making a presentation overcrowded is it has to be on your own judgment. If you're seeing that, if you're thinking it's a bit too much crowded, you should make 2 slides. You should make 3 slides even of the same topic. As for the posters, posters always look crowded from this place. From a bird's eye view, they would always look crowded. What you're gonna do is you're gonna focus and you're gonna increase the zoom to at least 50%. After you've increased it to 50%, your text should be clear. Your text should have some space and it should be clearly visible. As you can see, I've added 1.5 text space. If I add 1.0, it looks very stupid. And if I add 2, it looks very spanned out or very fanned out. So that's why 1.5 is the best point. And you're just gonna make it at your own judgment. Next question.
Okay, next question is, are descriptive stats are also as important as test to sig test of significance, or should we skip them? Or I could
The
repeat the
one of the
question.
main things that are important in descriptives in it's okay, I understood. The
Okay,
main
okay.
thing of the descriptives is that you're just gonna mention them slightly. As you can see, I've only mentioned the age, the gender, and the distribution of the type of stroke. But that's it. You're not gonna go into the details. You're just gonna skim through the descriptives. If your study is a descriptive cross-sectional study, then you're gonna go into the details. But if your study has analysis, if your study has test of significance, you're gonna focus on those tests like I did right here. We're not gonna focus on the descriptives because descriptives are not that much appreciated in research. It's always better to have a test of significance. It's always better to have uh, these things. Next question, please.
Okay, we have next question is in our chat, that is, published studies have an advantage over unpublished studies in term of attaining higher scores.
Okay, so one thing that I was going to mention at the end, but I think must have slipped my mind, is that in conferences which are international, for example, if you are presenting at the American Academy of Cardiology, American Academy of Neurology, or American Pediatric Association, etc., never ever send in published research, or never ever send in a research which you have sent to a journal, because the conferences have their own journals and then they publish researches there. So it's going to be a redundancy of the published material, and it's going to lead a shadow ban on you. So never ever send a published or a research which was sent to a journal to any conference, which especially the ones which are international and are online. Okay. Now, as for the Pakistani conferences, such as the one right here, the Neurocon one, or there was one regarding the neurosurgery happening in Serena, Islamabad recently as well, it's completely fine. You can send any research there. They don't mind because the journals in Pakistan are not PubMed indexed, and sometimes the societies do not even have associated journal. So it's completely okay. But you always have to send unpublished research to the international research conferences, right? Now, the third, so I hope that solves the question. And as for the normal conference, if you're asking if the research which is published or non-published has the upper hand, the answer is neither. They don't care if it's published or not. I mean, if it's not published, then obviously good for you, because you have now presented it at a conference, and now you know all the mistakes in your research. And now when you send it to a journal, you're gonna rectify those mistakes. But even if it's published, they don't care much, especially the people in undergraduate medical conferences, they do not care. Next question. I hope I was audible. Next question.
What is the most common criticism you get on an oral or written presentation? How to overcome it?
Assalamu alaikum. Fazan bhai, are you there?
Aisha, I'm sorry, I was unable to hear your question. Can you repeat it?
जी जी मैं repeat कर
Walaikum
देती हूँ.
salam. Yes,
Like
Haris, am I
question is,
audible clearly?
Yes, you're now audible.
जी भाई, अब आप ऑडिबल है। अब मैं आपसे नेक्स्ट क्वेश्चन पूछ रही हूँ जो हमारे पास चैट में पूछा गया कि जब हमारे पास ओरल और रिटन प्रेजेंटेशन होती है, उसमें सबसे ज्यादा क्रिटिसिज्म किस बात पे किया जाता है और उसका हम ओवरकम कैसे कर सकते हैं?
Methods के ऊपर the majority of the questions that you receive will be ones from the methodology. For example, in this research, the main question that they asked me was, why did you consider both types of stroke and not just a single type? And I said, sir, I considered both types because that's what the literature said. And they actually deducted marks. I think I was third position on this presentation, but I would have been a second if I did not combine hemorrhagic and ischemic stroke both. That was the first question. The second question they asked me was, why did you consider all of these prognostic factors? And I told them that literature review showed me that all of these prognostic factors that I have considered, this one in the table, orange table right here, are significant ones. And so instead of considering non-significant ones, I only considered these which were important. Then the third question they asked me was, you have written in medical units of Holy Family and VBH. Do you not have a specific department of neurology at these hospitals? And I said, no, we do not. And all of the neurology, neuromedicine patients, they get allotted to the um, departments of medicine, and hence we went to the medicine department. Then they also asked me a question regarding covariates, but that was dropped because they did not have enough time. So they were like, it's okay, we will ask some other time, or it's okay, like you don't need to answer. So the majority of the questions are from methodology, and the second majority would be from the results. And usually they in a poster presentation that would be all of the questions. They would not ask from anything else. In the oral presentation, they would ask from the rationale. They would ask about the to explain the rationale of your research. They would obviously ask from methodology. The inclusion exclusion criteria is very important. The sample size is very important for in this regard. Then they're gonna ask about this data collection tool. They're also gonna ask you about, once again, all of these factors that I considered. They're gonna ask, why did I consider this, which were significant, which were not significant, why were they significant. Then they're gonna ask the discussion. They're gonna ask you to explain the difference between you and your study and the literature published online. They're gonna ask explanation for the difference. For in this study, they asked for example, according to Zhang, the value was 15.34%, and in our study, I think it was 15.6, which is actually some similar. So they're not gonna ask you about similar stuff. But if I go to this example, they're just gonna, yeah, for example, the Lee et al. Considered 16.64 to be the cutoff value. In our study, it was, I think, a different. In our study, it was 13.51. So they are also going to ask, why is it low? Like, why is our cutoff value 36, but the value for Lee was 16? And we came up with the explanation for it, which was that the patients in the Lee were more severe, and hence the different value. So you see, that's how they were going to ask the question. They're not going to ask from limitations. Limitations, if you have told them about 2 or 3 limitations, they're not going to ask about it. They don't usually ask about limitations if you have completely mentioned it not. If you have completely skipped it, then they're going to ask about the limitations. In conclusions, they're just going to ask you, how did you drive this conclusion? So you're just going to be able to explain them how you were able to come to the conclusion that you're presenting, and that's it. That's the main crux of the questions that will be asked from you. Next question.
Okay, next question we have in our chat is, what is the value of more and more graphics in posters?
What is the role of graphics?
In posters making.
Graphics are actually divided into 2 things. The number one is the images or the pictorial stuff, which is right here. The one I'm highlighting right now. This has a lower significance. It is usually used for visually but then again, like I said in the international conference, they said me not to use this, instead and other stuff. So in a poster, the graphs, the pie charts have the most importance, and they basically, are the main cream of your poster. Whereas these images, try to add these images at a very minimal level, and you know they don't have much significance. One more thing that I absolutely want to make sure is there is something known as a graphical poster or a graphical abstract. You may have heard about this. A graphical abstract has minimal text and maximal pictorial stuff, as you can see right here. This is a graphical abstract. This is a graphical abstract. It has pictures and pictures. This is a graphical abstract. You see, it has pictures and pictures, but it has very low text. This is what a graphical abstract or a graphical research poster is. And if you're presenting a graphical research poster, you're gonna make a totally different poster than this one. This right here is a normal research poster. This right here looks more of a graphical research poster. And as you can see, this is a graphical research poster. This is a graphical research poster because they are more visually appealing. So if ever you like enter a competition which has the name specified of a graphical research poster, make one like this. Do not make one with extra added text. Whereas if you're just gonna add a research poster, which is a medical research poster, add the text, add a bit of graphs, add some pie charts, add some line graphs, add some ROC curves, and you're set for life. Okay. Anything else? Other question?
Next question is whether we have to use gradient colors or executive colors. Which is one is preferred for poster making?
Posters are mostly preferred in radiant colors, but then again, you're not gonna use bright red. You're gonna use sober radiant color. Like for example, if I click on this image, or yeah, it's just I'm not gonna include a color which is like a light green color, or I'm not gonna include color that is bright yellow or bright red. I'm not gonna include these colors. I'm gonna include sober colors, dark purple, dark brown, dark blue, dark green, like this green, dark green. It looks sober. Dark blue looks sober. Uh, Golden brown looks sober, not yellow, golden brown. You're not gonna use this color. You're gonna use this color. Okay. And uh, this one orange looks sober. You can also use a dark blue once again. I would highly recommend, no, not recommend using black or gray. Do not use black or gray in poster presentation. Like never use them. Never ever use them. You can use them in oral presentation. Like as you can see, my oral presentation is a bit bland as compared to poster. It's just a simple shade of blue, sky blue. But in poster presentation, never use black or make it light, right? You have chosen this purple color, but now you want to make it right. You can make it light. So how you gonna use it? You're gonna use green, and then what you're gonna go click on this. You're just gonna click on green again, and then you're gonna click on right click. You're gonna click on format. I think its option is like if you triple click it, you're gonna click on format, shape fill. Then you can change the texture, you can change the gradient, you can go on more fill colors, and then you're gonna adjust the color right here. You see, that's how you're gonna make it light. Okay. Other question?
Okay, we have a question that there is any website to look for latest international conferences?
No, there actually is not. But what you can do is, what I basically do is, I click on plus, I click on recent neuro conferences or neuro conferences 2024, and it's gonna tell you a list of all of these conferences. You see all of these websites, and you just have to open each and every website specifically and see their deadline. This was on 25th to 27 April 2024. Registration deadline was on 15th April. It has passed. Similarly, if you click on this neuroscience 2024, this was, I think, in October or something. Yeah, this one is in October. As you can see, it's open right now. The call for abstract is open right now, and it's still Tuesday, 7th of May. So this is how you're gonna find conferences. Any other question?
Moving to the second last question we have in our chat is, what is the best app or tool for designing posters?
Microsoft PowerPoint. Everything is Microsoft PowerPoint. You're gonna use Microsoft PowerPoint for oral and poster both. Canva, some people use Canva. Canva is used for graphical abstracts. I have not much experience of making graphical abstract. I've just made one graphical abstract and it was not good in my opinion. It was okay. It took way more time than it was than I expected. And until and unless a graphical abstract is an absolute necessity, I don't recommend making it because it's not appreciated in medicine as of now. This may change within the recent coming 3 to 4 years, but not right now it's not. So use PowerPoint. Anything else?
Okay, moving to the last question of this session is, should we focus on the result section or conclusion, or is there any way to combine them both?
Result section is the most important thing. You're gonna focus on the result section. You're gonna make sure your results are absolute robust. And in the conclusion, it's not much of a big difference because in conclusion, you're just gonna uh, summarize the whole results. You're just gonna tell a one-line sentence, which is gonna be the main crux of your results. For example, in this study, the results in our study were included that these three factors were the most important ones, right? Just so I can tell these three factors are the most important, and which is the main line that I've written in the conclusion is that all of these are the most important. So you're just gonna mention conclusion within a few seconds, whereas the result should be at least 1 minute, like at least 1 minute in a poster. So results is the most important thing.
Thank you, Faizan Bhai, for this question and answer session. And I'll conclude this question and answer session here. Now moving on to the next part.
Okay, thank you so much for inviting me, and it was an honor for me to come and present this presentation here. I hope I was able to convey my point. And once again, I would like to congratulate and tell you guys that this is a very good job. There are not many webinars happening on the art of research presentation. I'm really glad that you guys conducted this one.
Thanks a lot, Fazan Bhai. We are grateful for your time and enlightening us with the knowledge. We are sure to bring you back at our channel from time to time so that our audience can experience such high, full, valuable content. I would excited to announce that tomorrow we have arranged another workshop on the topic data analysis disconstructed, in which the science of biased stats will be open to our audience. So stay tuned for our channel for the next workshop. Thank you all for joining us today. Thank you so much, Fazan Bhai. Allah Hafiz.
Thank you so much, Allah Hafiz.
Allah.